NASLEE Roundtable. We're so glad to have you here with us on this third day and hope you all have enjoyed the content so far. We have a great lineup today with some conversations around equity, and also we'll be hearing from Miriam Calderon with the administration to hear a little bit more about what US Ed is doing. So just a reminder, we will be sending out recordings of all 3 days as well as the slides from presenters. So be on the lookout for that. We'll also be sending around a survey and we'll talk a little bit more about that towards the end today. So be on the lookout for that as well. And just one last reminder to tweet, of course, our new name that was announced on Monday. If you haven't heard, if this is your first day being able to join us, this is our brand new name. We will be rebranding under this much more inclusive name, the National Association of State Leaders in Early Education. So be on the lookout for more around that, and feel free to follow us on Twitter at @NASLEE_ and use our hashtag for this meeting. One other quick announcement, just wanted to get a save the date out there for you all on Wednesday, November 17th at 4 p.m. Eastern. We will be partnering with a couple groups here, very excited about this, to talk about community-based and pre-K inclusive opportunities for children with special needs. So put that on your calendar, and more to come on the listserv for that. At this point, I'm going to go ahead and turn it over to our moderator for our first session. Our moderator is Jeff Capizano. He is the president of Policy Equity Group, and he'll be leading us through this first session. Jeff?
Great. Hey, thank you, Mandy, and welcome everybody. Welcome to the panel on making strategic decisions to advance equity in early care and education. I know a number of you have been having conversations about racial equity throughout the meeting. And in this panel, we're going to focus extensively and exclusively on sort of the topic of racial equity. I understand this was kind of a priority of the states, and so we're looking forward to sort of digging deep in it. It's been an amazing year, sort of in terms of a different context for thinking about racial equity. You've got President Biden issuing the executive order on racial equity on his first day of office. You have a report on methods to assess racial equity that came out from the Office of Management and Budget in July. And now you have these federal agencies working on action plans related to racial equity. And I think, when just kind of thinking about the report that came out in July, there are 2 sentences in the letter that was written to introduce the study that I wanted to share with you, because I just think it's so germane for the conversation that we're having today. So the letter reads in part, systemic bias, including across the federal government, can flourish in practices that appear to be neutral on the surface. While we may not notice assumptions in organizational practices that in subtle ways limit possibilities for others. And I think that's really important, because I think all of us here are very well intentioned about the issue of racial equity. And I think really sort of what we need to think about are those places where there might be unintended consequences to our work. And I think, that's going to be a topic we're going to talk a little bit more about. I think, it's a great time to talk about this too, because of all the opportunities that are available to us. I know, a number of you are working on sort of ARPA implementation and trying to, to push out that funding. And I know that Katie talked, the other day about, the opportunities around the Build Back Better Act. So, as we're, thinking about sort of all of these opportunities, how are we applying a racial equity lens to the work? And I think, thinking about racial equity, one of the things that, can be sort of a source of frustration for me is that, there's really, there's a lot of talk about racial equity, and there's a lot of good intentions around racial equity, but the question is, like, how are we operationalizing this construct of racial equity in our work? And so I know a number of you have worked really hard on the child care stabilization formulas and thinking about, what is the most equitable way to be getting that money out? And so we need to continue to sort of kind of think about that. And I think, for those of you who really were focused on that, that one, it takes a lot of hard thinking to do this well, and it takes a lot of capacity. And so, one of the things that we wanted to do with this panel was, bring you a set of speakers that can help you think about the best ways of operationalizing racial equity in our work. And so let me take a minute to introduce everybody. And so our first panelist is going to be Dr. Chantel Meek. She is a professor of practice and the founding director of the Children's Equity Project at Arizona State University. Prior to founding the Children's Equity Project, she was in the Obama administration and served as a senior policy advisor for early childhood at the U.S. Department of Health and Human Services. And then she got to move over to the Domestic Policy Council, where she was a senior policy advisor. Chantel, do you want to smile and wave for everybody? She's going to be talking about an equity strategic planning tool. Looking forward to that. And then our next panelist is going to be Melissa Sutton. Melissa, can you smile and wave, say hi to everybody. She's a program coordinator for Arkansas State University Childhood Services. Her work has been providing technical assistance and training for early childhood professionals in Arkansas. She has over 30 years of experience, and she is going to be talking about Arkansas's behavior help system and what it's done to promote equity and address suspensions and expulsions in the state. Obviously, a key issue around racial equity and disproportionality. Then we'll have Dr. Nicole Russell. You want to say hi, Nicole? Wave hi. She is currently serving as Vice President of Implementation Research at Teaching Strategies. She's been a Head Start State Collaboration Director, and most recently was a state level administrator for the state of Arizona. And she's going to be talking about some of the equity work that she was doing with the state. And then finally, we have Dr. Megan McCormick, who's a Senior Associate for Family Wellbeing at Children's Development at MDRC. Say hi, Megan. Her work focuses on better understanding children's learning and family interventions, including work on equitable access to early childhood programs and early childhood assessment. And she's going to share some of her work on early childhood assessment from an equity perspective. And so that is our panel. We're really looking forward to hearing from them and engaging you in conversation about equity. And I'm going to hand it over to Chantel to talk a little bit about the strategic planning tool. Thanks, Chantel.
Thanks, Jeff. Pleased to be with you all again today and talk a little bit about a report and a strategic planning tool that we published earlier this year. Time is kind of all meshed together. But in December of last year, we actually published a report called Start with Equity, 14 Priorities to Dismantle Systemic Racism in Early Care and Education, which really had the goal of kind of what Jeff mentioned earlier, operationalizing racial equity within our policies and breaking down what that looks like. And so within each of those 14 priorities that we identified, there are really concrete and actionable actions for Congress, for federal agencies, and for states to advance our progress within each of those priorities. So I'm going to talk a little bit about that very briefly, since we don't have a ton of time, and a little bit more about a tool that we published a few months later to help with implementation of these policies. Next slide, please. So we had a long list of authors and Children's Equity Project partners from across the country really contribute to this work. Next slide. And it was published in partnership with a whole number of national organizations that kind of came together to put together an equity agenda and a concrete equity agenda to really kind of all move us in the same direction and making progress on a lot of these issues. Next slide, please. So before we jump into kind of what those 14 priorities are and kind of how we're thinking about it, we provided, hesitate to say definition, but kind of our framing for what an equitable system looks like in learning settings. And it really consists of three parts and three pieces. It's really, the first piece is access, right? Who gets to access our systems and services, who gets access to resources. So it's who gets in the door, basically. The second part is what happens when they're in the door, what happens when they're in our systems, what is the quality of services, what are the experiences of children, particularly children from historically marginalized communities, children with disabilities and others within our systems, what does that look like? And then the third piece of it is really the outcomes piece. What outcomes within equity are we accountable for? Are we actually closing disparities where they exist? Is that an expectation of our systems and of our programs? And is that built into our accountability? Next slide, please. So we kind of looked at this framework of access, experiences, and outcomes across the different priorities and thinking, and I kind of leave this with you all too, in trying to operationalize equity, right? These are three kind of useful buckets to think through our work and how kind of different, more specific policies land within each of those. Next slide, please. So this is a long list of the 14 priorities, and many of them fall within different buckets of access, experiences, and outcomes. But it really ranges from everything to how we allocate funding and what formulas we're using to allocate funding and what factors are we considering when we are allocating funding, to looking at what integration and versus segregation looks like at the classroom level, and if our policies are promoting one of those or the other of those. Thinking a lot about accountability, about monitoring, and about what that looks like if we're building that into the system. So often our accountability is, based on, school readiness, or kindergarten entry assessments, or in general, right? And equity and what the disparities look like within that isn't a part of those systems. And so really making sure that we're building those pieces into our monitoring systems, into our accountability systems, and of course, into our standards on the front end. Of course, the workforce, advancing equity within the workforce, getting at the pay disparities, racial pay disparities, position pay disparities, system pay disparities, age, based on the age of kids that you serve, disparities. There are disparities kind of across the board, not only in pay and benefits, but working conditions, as we all know. The next one is really PD, and getting to our preparation and professional development systems and ensuring that equity and all of these different equity dimensions and components are a core part, like they belong right next to child development when we are preparing our future workforce, and ensuring that that's really embedded. Thinking about quality rating systems and different standards that we have, and not only the accessibility of those systems and resources for providers, particularly providers who serve historically marginalized community, but also the literal content in those. So like, what are the expectations at each of the levels of quality for equity that programs have to meet to really come into the system and move up in the system? Thinking about pedagogy and curriculum, thinking about global classroom quality measurement. A lot of the tools that we commonly use now do not give us any information on the individual experiences of kids. And so if you are rated, a 7 or a 6 or something at a global classroom quality level, does that mean that the nonverbal child with autism is getting a 7 experience? Does that mean that the dual language learner who may not share the same language with the provider or the teacher is getting that same level experience? Or the Black boy who maybe have been unfairly the subject of bias and had, relationship, right, issues there with the teacher because of these different dimensions? We're not capturing that, right? And if we're not including that in our expectations of quality, I think that's a problem. Of course, there's been a lot that's been written and talked about, a lot of data on harsh discipline and the disproportionate application of harsh discipline, and really thinking about our policies at the state level, at the district level, at the program level on harsh discipline, and on actually addressing disparities within harsh discipline. Because again, I think with this one, we tend to just go to decrease harsh discipline and expulsion and suspension, but not targeting the disparities. And when we do that, we've seen that policies do decrease the rate, good policies decrease the rate, but that the racial disparities have kind of been stubborn and have not changed at all over the course of time, despite these huge waves of policy action at the state and federal level. Thinking about equity for kids with disabilities. So what does access to early intervention and preschool special ed look like, and who's underrepresented or not? What does inclusion of kids with disabilities look like, and what are our efforts there versus these segregated, antiquated, self-contained systems that are very large in many states? What does appropriate identification look like of kids with disabilities and access to services? 11, really thinking about our data and our continuous quality improvement systems. How are we building equity into that, right? So we kind of talk about an equitable continuous quality improvement system where we are constantly tracking inequities in inputs and disparities in outcomes across our systems. really thinking about family leadership and looking at Head Start as a model for that piece of it, thinking about family childcare and their access to resources, to being part of the system. And really 14 is thinking about our dual language learners and equitable access to bilingual learning for kids who are dual language learners. So all of these, as you can see, kind of fall into this broader framework of like, who's getting in the door? What do those experiences look like once they're in the door? And what outcomes are we seeing, you know, as a result of the work that we are doing within our systems, and how do those differ? Next slide, please. So a few months ago, I think over the summer, we published this equity strategic plan template, which goes with the earlier report that I just discussed. And that really breaks down in a table, in a fillable PDF format, a tool for states for how to begin to plan across these 14 priorities. Next slide. So it starts, there's kind of 3 parts to it. The first part is just kind of tracking, all right, where are we across each of the 14? And what does our overall progress look like? And that may kind of lend itself to like, all right, where do we have the farthest to go? Where should we start? And where should we go from here? Next slide. So the first part, and you can go to the next slide too, is really the current landscape analysis. So where are we now? So it asks a bunch of specific questions about the current policy landscape for each of the 14. So here's an example of priority 9. What are our policies across each of the different parts of the system? What data are we collecting across each of the different parts of the system? What funding is available to advance this priority, or can be available, or is flexible that we can allocate to these pieces? And what structural barriers might exist across each of these different priorities that might be outside of our immediate system, but are housed in adjacent systems that our families interact with all the time? Next slide. And then part 2, and you can go to the next slide too, is really then defining where you want to go. So what are the goals? How do we get from here, where we are today, to where we're trying to move? And so the template kind of has the policy goal all the way on the left-hand side, which is one of the 14 priorities. The benchmark, which are the specific recommendations, actionable recommendations in the plan, and then action steps, persons responsible, and target dates and timelines to fill in at the state level. And then there's some open boxes at the bottom to kind of fill in additional benchmarks and action steps that states can pursue. So I think that's my last slide. And I think I'm somewhat on time. So back to you, Jeff.
Great job, Chantel. Thank you so much. And I think, just thinking about sort of how busy everyone is, pushing out all of this money and doing all of this work, I think it's just so important to have a framework like yours in order to, to stop and sort of reflect on the work that's going on, asking these sort of questions, of your work. And so I just really appreciate everything that you're doing. And hope all of you out there will be using this tool to support, the implementation of what we hope is more federal early childhood money. And I know Chantel talked about harsh discipline, and I know Melissa is going to follow up with a conversation about her work in Arkansas. So Melissa, why don't you take it away?
There we go. Thank you. I'm honored to represent Arkansas today and the work that we've done to prevent expulsion and suspension. You can do the next slide, Mandy. So in 2015, Arkansas established a work group to explore what the state could do to begin to reduce the numbers of children birth to 5 being suspended or expelled from their early learning environments. This was on the heels of our receiving the U.S. Department of Education and ACS policy statement on expulsion and suspension in early childhood settings, and changes we knew were coming related to the Child Care and Development Block Grant reauthorization. The Arkansas Expulsion and Suspension Work Group was developed to begin this work to see what would we do in our state to prevent expulsion and suspension. We had leadership from most of the main units within DCC-ECE, such as licensing, our QRS system, state-funded pre-K program, and our CCDF family support unit. The external partners were basically anyone who could possibly be a helper in whatever solutions we might possibly come up with to address suspension and expulsion. Some of those included were some division from the Division of Behavioral Health, professional development contractors, our TA providers, trainers, early childhood mental health consultants, experienced early childhood professionals, special education staff, Head Start collaboration, and Project Launch. Next slide, Indy. The work group began their work with the understanding you cannot tell people they cannot expel or suspend children without giving them an option and support. So the group came up with a couple of solutions. One solution was a new policy. Of all the policy approaches to limiting suspension and expulsion, I think the approach Arkansas has taken is really probably the simplest. For years, we have had a policy in our state pre-K that basically says you can't expel without getting permission from DCC-ECE. The limitations were that it only covered pre-K, and there was no real system for monitoring or providing timely supports programs that were really struggling. We didn't even have data about how often it happened, but it was a start. So in July 1st, 2016, this simple policy statement was embedded into the participant agreement for our voucher providers as well. There was already a long-standing Head Start policy in place. So with the state-funded pre-K policy, as well as the added policy for programs receiving child care vouchers, this now covered 75% of our early child care providers in Arkansas. So the expansion to voucher providers was a real change that was easy for us to implement. However, we all know expulsion is a really complex issue for which there are no truly simple solutions. For us, the complexity sits in the other solution developed by the work group, and that is our support system, which I'll describe now. Next slide, Mandy. The work group also designed a support system called Behavior Help for your behavior. Let me give you an overview of our system. It is designed to provide a single point entry for serious behavior-related problems in childcare. The system starts with an online brief help request. Whoever submitted the request, whether it be a parent or a provider, sometimes it can be a mental health support therapist, they will receive, whoever makes the referral will receive a phone call from a DCC-ECE behavior help specialist within 2 working days. They then will complete an interview with questions about the situation designed to help them identify the most helpful next step. We have a 3-tiered system, as you see here, with cases moving up the tiers based on what we understand to be the nature of the case, the severity of the situation, the red flags that stick out. So for tier 1, we have concerning behaviors that are sometimes developmentally normal and provider frustration is not excessively high. The DHS behavior help specialist can share information as well as resources. This might be something as simple as information about a biting 2-year-old or the importance of a bedtime routine to share with parents. This is not usually the case though, but the specialists are prepared to share the information if they think that it would be helpful. At tier 2, we have concerning behaviors such as hitting, kicking, biting, throwing things, and the provider frustration level is high. TA is provided by a team of developmental, social, emotional experts. Typically, their work consists of environmental adjustments as well as helping the adults develop strategies and structures in the classroom for all the children. At tier 3, there are concerning behaviors that are extremely severe, could possibly be a result of trauma and/or included a multi-system involvement. An early childhood mental health consultant will work with this case, which will include supporting the teacher, specific strategies for this child, as well as supports for the family. So we can just stay here, Andy. So in our 5 years of doing this very rewarding work, we have had 1,739 requests go through our system. with an expulsion rate of only 3%. 66% of the cases have been assigned to TA at Tier 2. 31% have been assigned to mental health consultation at Tier 3. And then we have 3% where over the years we figured out we're really good together. And in some situations, the small number, we do collaborate together and meet everybody's needs in the situation. So as a result of our work, 86% of participants have said they would use behavioral health again, and they have. 89% have stated they would recommend behavioral health support. We have developed a team of professionals working together from all of our different roles that I'll go into later. Hopefully I'll have time to support teachers, children, and families. Our team meets each Monday at 2 o'clock. Yep, every one of them at 2 o'clock. We staff cases, learn from each other, and decide next steps for our behavioral health referrals who have asked for help. So that's just a little picture of what we do.
Great, Melissa, thank you so much. And we look forward to sort of unpacking a little bit more of the model in the Q&A. I wanted to hand it over to Nicole to talk a little bit about sort of her work in Arizona, and looking forward to hearing from you, Nicole. Thank you.
Sure. And when thinking about what work has been done locally, I think about work that I did previous to coming to teaching strategies while at the Department of Education. But what's happening more recently relates to the work I'm currently doing at Teaching Strategies, having folks who are reaching out, literally saying, how do we do this? And getting really specific questions about, we're being asked to define metrics around children who are at risk. Can you help us think about what does that even mean in early childhood? What does it mean to be at risk? And that comes so loaded with some assumptions about who children are. I got a request just last week about children who are in Title I schools. How do we make a definition of at risk academically for children to receive Title I, children for whom we receive Title I funding? And they are asking for thought partners to help them think about, how do we redefine that? How do we educate others who are asking of us and holding us accountable to these metrics about what that means and how that term came to be even? And that's a shift in what I saw before, where folks were just using things like socioeconomic status or demographic data, like what race is that child, as their at-risk category. And so that's sort of signaling this shift that I'm seeing nationally happen, folks being willing to challenge that, right? Not to just go with what has always been done. And that's a significant change, I think. And when I think about the position statement NAECS put out on advancing equity, that's one of the recommendations that's in there, is to recognize that our professional knowledge base is changing. And it encourages people to challenge things that no longer serve us, things that we feel aren't representative of the work that we're trying to do to advance equity. And a lot of that takes bravery and courageousness and willingness to engage in conversations that might be difficult. And that's the other thing that I'm recalling in my head right now, is work that I've been seeing done around the state here in Arizona around forming these learning communities that really are centered on how do we have courageous, critical conversations about our problems with equity. And how do we get honest with ourselves about where are we currently? I love that Dr. Mead talked about surveying, like, where are we right now? And part of that means you have to be honest and brutally honest and say, here's where we're falling down. Here's where we have let children and families down. And this is what we need to do about it. And once you've established that, really work on how do we now help practitioners develop the knowledge and competencies they need to really become action-oriented when it comes to equity. That framework that Dr. Mead talked about, that's great for, I think about the state level work that we do, and you come up with these great plans. And then it comes to, like, how do we get all the way down to the person in the room with the children, talking with families daily? and that kind of focus on at every level in our system, what are we influencing? In my role right now, I talk to a lot of leaders of programs for early learning. And that's unlike what I did at the state, right? Where I was very focused on what is our state doing? How are we addressing our children? But I think if you can broaden that to think about where's the momentum nationally, and can I lean into some of that, that we can find that there are many, many resources out there. There are many examples of our colleagues who are doing this work where we don't have to start from some zero. We're not starting from nothing. There are many places where we can already begin from. And if we tap into that, it can make the work feel doable. And I think that's what I'm finding when folks reach out is rather than saying, wow, this is too big, too heavy, too much work, I'm going to be stuck and do nothing. Folks are saying, no, we are committed to doing it. We're reaching out to say, can you help us in our thinking about this? Help us in organizing our first next step, or what's our big overarching plan? And so I'm finding that more and more people are willing to roll up their sleeves and get in and do the work. And we're at a time where that willingness to do the work is being matched by many really good resources being created and delivered to help us to help show us how to get it done. The one example we saw this morning about making that strategic plan is excellent. And there are many other folks putting out plans that we can lean into for helping to craft the direction in which we should go, for us to do self-reflection on where are we currently and then where do we want to be in the future. So that ability to reimagine what it could be to come before a group and say, here's what we're doing about equity. Look at where we were and look at where we've come in 1 year. Look at where we've come in 2 years and 5 years. That ability to see change, like, the change that we want in the future, I think is something also that can help sustain this work over time.
Great, thank you so much, Nicole. I think, your initial example of just, defining sort of at-risk children, I think was really interesting. One of the things, and kind of, thinking about the Build Back Better Act and looking at some of the language, particularly in sort of the pre-K part of it, where they're talking about, they want to have universal pre-K, but they, the feds understand that, you're not going to be able to roll it out all at once. So you want to be rolling it out in those communities with the highest number of at-risk children. So the question is, how do you define that? Who are they? It's like, who takes priority? So, I really appreciate that. And I look forward to talking a little bit more about that with you in the Q&A. And then now I want to hand it over to Megan, who's going to talk a little bit about sort of her work on early childhood assessment, which, obviously has significant implications for racial equity. So Megan, take it away.
Great. Thanks. This is amazing to be on this panel because I've heard all of these panelists talk in other forums about equity and been very much inspired by their own work and the project that MDRC has taken on. So I'm just really a representative of our team. And my colleague Amina Sengal is going to be joining in the breakouts to talk more about this work. But MDRC is a social and education policy research organization. So we are really researchers, but we have always had the mission of doing work that aims to directly improve the lives of families experiencing poverty. And really in the last 10 to 15 years, bringing a strong focus of all of our research having the goal of enhancing racial equity. And to this end, we have always struggled in our own work with challenges related to assessment. So obviously as researchers, when we're evaluating different programs and trying to understand which curricula and professional development approaches work best for kids, we assess children and we try to evaluate different domains of skills to understand, what's the difference in those skills that we see for kids who get a given curriculum versus those who do not. And we've always struggled with this issue of assessments themselves. Many of the ones that we use in our research being challenged because they sometimes in and of themselves can be biased. So obviously we use like teacher reports of students' behaviors and self-regulation skills, But even direct assessments of kids' vocabulary, for example, we know from people who have actually looked at the psychometrics of these tools that were really developed to be used by upper income white students, and they don't necessarily reflect the lived experiences and the daily vocabulary of kids of color, kids who are not from those backgrounds. And so there's really a pressing need as we really center equity in early care and education to think hard about how to bolster and strengthen assessments of kids' skills, as well as assessments of classroom quality, as others have mentioned, to really focus on equity. And so MDRC is really, I don't have any slides because we're doing a very new initiative that we're jumping into now. So we're hoping to talk about this in the breakouts and get feedback from folks in this group. We're working to think about how to strengthen and bolster assessments so that they can be not only more equity centered in and of themselves, but they can be used for a fundamental goal of promoting equitable opportunities and outcomes for children and families. And so we're looking at this work from multiple levels. The first is to really think about the tools themselves and the assessments that are being used to describe children's skills. And we've all heard ad nauseum about gaps in skills and gaps in achievement. But we really, in our project, are trying to think beyond that descriptor, because we say there's gaps in achievement, but based on a very limited set of skills that we are measuring with our current assessments. And we're trying to think about, what if we had the capacity to consider a fuller range of skills that really can be used to identify all kids' strengths and all of their individual opportunities for growth? What type of skills might we measure that we're not currently capturing? We know, for example, that kids of color have extremely strong oral discourse skills. Those are skills that we're not really capturing at scale because they're difficult. It's difficult to get them. It's time consuming. It takes a lot of training to get that type of information. And so in our work, we're working with a range of different stakeholders, including some folks thinking about this from a technology angle, to really think about the types of skills we're measuring and to prioritize capturing a broader set of skills than we have to date. So we have talked about it a lot, kind of related to measuring beyond the ABCs and 1, 2, 3s, and really capturing the nuanced set of skills that different kids are coming to pre-K programs and to kindergarten settings with. Because every child, as we all know in this room, has a core set of strengths. But when we don't actually have the tools to measure those strengths, it can really perpetuate a deficit narrative that we are trying to avoid in this, we're trying to address in this work that's centering equity. At the next level, we think that it's really important for tools to be able to be collected by all different types of teachers and all different types of settings, regardless of the resources that the kids and the teachers in the centers have. So we, in our own work, and I'll talk about this more later, we have observed that in centers that have a lot of resources and they have a lot of investment in assessment, teachers have a lot of support, and they have a co-teacher who's going to come in and be with the other kids while they're doing assessments with students that they're focused on. They have a lot of support from center directors to think about what those data mean and how they're going to use that to work with individual students. That's not a consistent story that all centers and all programs have. Other teachers might just be given, a requirement to do these worksheets on these kids and tell me what the scores are later. And that's not promoting equity for anyone, because that's actually creating a big disparity in the opportunities that teachers and kids have to learn about how their strengths can be built on and what opportunities they have to continue to grow and develop and learn. And so in our work, we're also thinking about how we could leverage different types of technologies and kind of advances in how we actually get these data to ensure that all teachers have the training and support they need to get assessment data at scale and actually use that information in an effective way that's going to make their teaching practice more effective rather than a burden to them or something that is avoided at all costs. And then at a systems level, we think it actually is really critical to get information on all students across all different settings and to not have, we only have this type of data for these types of schools and these types of districts. But then we actually have math skill data for these types of schools and these types of districts to be able to actually make investments, as others have alluded to, into the centers and the contexts that really deserve the most investment using that type of equity framework. We need to have information on how kids are doing, what their areas are for growth, and target those investments at those contexts. And we can't do that without having systematic data and a data infrastructure that really supports that at scale. And so in our work at MDRC, we are engaged with a variety of different partners and stakeholders, many folks in this room who we've already talked to think about how can we integrate the perspectives of policymakers and the perspectives of center directors and teachers and parents to really not necessarily re-envision assessments, because there's a lot of good stuff already happening, but really bolster and strengthen assessments so they can be used to achieve equity goals at multiple levels. Because these tools are obviously intended to improve instruction, to improve children's educational experiences, and to ensure that the opportunities and educational experiences they have are not predetermined by their race or their socioeconomic status or their linguistic background. And so just little snapshots. I don't have like great findings to share with you like some of my other or recommendations like some of my other presenters, but we're really focused on those goals and kind of this idea that we can harness assessments as a tool to promote equity. And there's great examples of that starting to happen in different states. So for example, Virginia is rolling out new kind of like technology enabled assessment tools that they are giving targeted supports to community-based centers and childcare centers and home-based contexts to be able to collect at scale. And so those are the types of examples that we're learning more about and thinking about how that can inform other folks in other states looking to make these investments in assessments.
Great, thank you, Megan. I had a colleague that always used to talk about assessment as a systematic way of getting to know a child. And I always thought that was really interesting. It kind of took sort of the methodological rigor away and sort of humanized it in a way I think is important for a lot of stakeholders. And I just really appreciate sort of, the focus on, the things that assessment is supposed to be used for. It's supposed to be strength-based, and it's supposed to be used to sort of support the teachers and supporting the development of the child. And I think, one of the things that's kind of coming out as a theme is that, we have to be thinking about equity really at multiple levels. And, for me, it's like, you have to start sort of with us as individuals, right? So what are our sort of implicit biases? Like, how do we view the world? How organizations are engaging in their processes to, ensure that, there aren't biases. Chantal had given this, example about, classroom assessments. And then, what are we trying to do at the systems level? And we have to be thinking about kind of all of those things at once. And, just kind of, thinking about that and thinking about kind of all of the work that's going on across the country and how just, and I don't know if you're all feeling this as much as I am, but just so strapped and so busy. Just wondering about sort of, how sort of a lack of capacity might be negatively affecting sort of some of our equity work. I don't know, Nicole, if you want to maybe take that on as a former state administrator first. I'd love to hear your comments on that.
Yeah, I alluded to some of that in my earlier comments, but really looking at how do you help build capacity? And it's everything from, what kind of professional development are you offering to inside of those professional development opportunities, have we addressed that equity question? I love that was one of the priorities that Dr. Meek talked about, right? There's this need for us to look at how do we perpetuate knowledge? And if in professional development and in our preparation programs, we're not also assessing there, what in here is helping to promote the status quo that we haven't yet disrupted. We have to do that work first. Mm-hmm. And then it's understanding how do we target what kind of professional development to provide to practitioners. It's not the same for everyone, right? You think about the roles people work in. If I'm an administrator who has programmatic decision-making power, I'm going to need something. Then I'm a classroom practitioner or a home-based practitioner who has power for influencing what happens directly with children and families. But the knowledge I need and the competencies I need, they're different. So you can't take this blanketed approach to capacity building. It has to be specific in those contexts, but it also has to be professional development that has been gone through a check of some sort, right? Is this what I want to continue teaching? Is this what I want folks continuing to reproduce knowledge about? And if not, I need to change that. It's not just saying, oh, yep, we did that a year ago and we do that every year. That's no longer good enough. When we think about capacity, folks want skills to do this and to do it well. And that means for many of those who provide professional development, it's saying we need new stuff. This is not enough. We're no longer taking minimal as okay. We need to improve that.
I appreciate that. And Chantel, I'm wondering, like, one of the numerous benefits of this tool is that it does make it easy for state administrators to think about this, and it creates a framework for them. And I'm just wondering, like, what is your ultimate vision? How would how do you want states to use this tool? And what did you have in mind as you were developing it?
I think with equity, I feel like the question always comes up on, should it be like a standalone thing, whether that's PD, whether that's, whatever a coach, whether that's whatever it is, or should it be embedded in everything? And it's kind of like a false dichotomy, right? Like my answer to that is always both and so, yes, we need it to be embedded in everything we do. And yes, we also need really specific PD and targeted policies that address these issues in particular. And so when we set out to develop this template, the idea was, let's provide a tool so that states can build an equity strategic plan where they have all of these different dimensions in one place so that it could be accountable. And let's also make it so that it could be helpful to inform existing state plans, because we know, there's CCDF state plans and there's ESSA state plans, and there's lots of different state plans for different programs that should also have equity embedded. And different priorities might be relevant for different state plans based on that. And so I think the vision is really like, let's have one place where all of this lives, which makes it easier to track and keep ourselves accountable to moving it forward. And let's also use it and pull from it to inform all of these other state plans that states either have to send to the federal government or for funding or for whatever purposes. So I think that's the vision. It's one, to really operationalize equity and like put it on paper and have a tool where you can actually kind of just sit down and have these probing questions on where you are now and where you want to go, kind of facilitate that process and to both inform all the existing stuff that states have to do and like a standalone equity strategic plan that can be used for tracking and accountability purposes.
Great, Chantel. And we have a question from the audience about whether or not if any of the panelists have examples of state standards for early childhood that address equity in a robust way. I don't know if they're talking about program standards or early learning standards, but I don't know if any of you have good examples of that.
I always point to Arkansas. I've been pointing to Arkansas since like 2015 for discipline. Yeah. So I was excited to see Melissa on the panel. But honestly, in 2020, we published this report is that different than the one we talked about today, but related, where we took a really deep dive on discipline, on inclusion of kids with disabilities, and on DLLs. And part of what we did, we examined the data landscape, the research landscape, and then the policy landscape. So what are states and the federal government doing about these three areas? And it was really hard to find a state that was doing really well in all three of the areas. It was hard to find states that were doing really well in two of the areas, right? Like there are some examples that we can find, like this state's doing a lot on inclusion. This state's, we can hold up for discipline. But I think it was difficult to find kind of states that especially in the 14, which goes even much broader, across all of them. But I think there are good examples in particular dimensions of the stuff that we've talked about. And I'd be remiss if I didn't mention Head Start standards, because they are not a state standard, but they are, I think, the most robust set of standards we have for kind of early learning programs that get to some, but not all. They're not perfect, but they get to a lot of these different indicators.
Yeah, and who knows, Head Start standards might become state standards if you look at the Build Back Better Act with sort of some of the language around, pre-K standards, mirroring Head Start, and, top tiers of the QRIS being, Head Start performance standards. So, we'll circle back on that for sure. Melissa, I just wanted to give you a chance to talk a little bit more about the work in Arkansas. I just, it was really intriguing that, kind of a simple barrier of asking permission to suspend or expel, has this effect, and then gives you the opportunity to sort of end up doing these tiered interventions. And just wanted to, are there other things that are happening sort of in Arkansas, sort of on the policy side that you can talk about? Or
Well, yes, actually, thanks, Jeff. We, whenever I think about the work that we do, it wasn't quite as simple as just asking permission if you could expel or suspend a child. But I'm really proud of the support system that we have in place, the 300 system. And it involves people from the division, like I said, from licensing, QRIS, leadership, voucher, family support, and then those of us who provide technical assistance, coaching support, and training. And so whenever I listen to all of us talking, it's like we all want to find that way that we can help. And I think that our support system is well on its way to do this, because we have prevented a large number of children from being expelled, because it can kind of be connected with a conversation with their funding, and they're seeing that now when we come in to help you, we're really there to help you and the child, and to model and implement strategies to help all of you be successful. So at the different levels, at the regular TA level, we go in there and kind of look at the environment, and we're like, so what's really going on here? Are these adults that need to do things differently? Are there things in the environment that need to be added, need some structures? And that's the biggest amount of where you're talking about the professional development and the lack of teacher knowledge. We see that so much. And whenever we can get in there and model and try to help them come up with a professional development plan of where they really are, and meeting them where they are, where the teacher is, and get her lined up instead of just picking something. I think, Nicole, you kind of alluded to it, that we just have, this is what we've been doing, and so we just do it and go to this training. Well, if the teacher's not ready for that, then it's falling on deaf ears. So us going in the room and spending time there, it's spending time with the teacher, spending time in her classroom setting and figuring out, okay, this is where she is. This is where she's ready to learn and to do different things. So I feel like that is a really big piece, and something that we're proud of. I mean, we see things all the time, though, that there might be, I think Chantel alluded to it earlier, we've had a few situations where we've realized that the present child care facility was not the best place for a child, and they really didn't need to be there any longer. And that we were going to get these teachers support and help, but this child needed a different environment. And most of the time it's due to they're at one of our lower quality centers, or the teachers that just don't have social emotional development training, or the lack of training at all. And I know that COVID the last year and a half, I don't know about everywhere else, but we have definitely been affected by, we have some warm bodies in a classroom instead of people who've been trained. And that really made us re-look, and Jeff, you asked about policy. We, in July, this past July, our division staff looked at, okay, we need to get some procedures in place that are very specific and telling people this is how behavioral health works. And they stated they have a new purpose statement that says behavioral health is not a crisis line. It is a support system for programs with children experiencing challenging behaviors. As such, submitting a referral to behavioral health should be done at the onset of the challenging behavior, not after the situation has become an immediate crisis. And so we're seeing that was needed, and we needed procedures in writing that kind of were meeting people where they are now, kind of like you said, Nicole, maybe not using an old procedure, that we needed to really see where we are now and put those procedures in place.
Thank you, Melissa. And then we're hitting the top of the hour now, but Megan, just, you know, from an equity perspective, I just wanted to give you sort of a time for the last word, if you have one.
Yeah, I think that, I mean, it's really encouraging and exciting to see such a focus on equity. Like, I know at MDRC right now, we have shifted to a position where we don't even want to do a project unless that's kind of a clear central goal, is to really focus not just on learning about inequity, but doing something to promote racial equity specifically. And I kind of echo some of the concerns of folks in the panel that it really is more than just okay, this is what we're focused on for this year, and then we're going to move on to something else. This is really, like, for us in this project we're doing, this is like a decades plus multiple long period of time, like, commitment to really being focused on this and not losing sight of that, given that, as all of these other panelists have said, this is challenging work. This is going to be hard work, and really going into it knowing that it's not going to be just one project or one activity, but really a huge transformation in how we go about thinking about delivering early learning services, I think is exciting. To see so many amazing folks focused on that and really getting the conversation moving in that direction. And I'm really a student of these other folks, so I'm just happy to be part of this conversation.
Yeah, very well said, and I agree. I've learned so much from all of you in this discussion, so I really appreciate your participation. I appreciate everyone in the audience tuning in and listening, and I wanted to hand it back over to Mandy to talk about the logistics of the breakout. Thanks, Mandy.
Thanks so much, Jeff, and thank you so much to all of you panelists. This has been a great session, and it's been a great way to kind of tease the conversation for a deeper dive in our breakouts. So we're so excited that all of our panelists will be able to join us in these breakouts. And like the other 2 days of Roundtable, you'll have a chance to pick which breakout room you want to go in. So we'll be doing that when we return from our break right at 2:15 Eastern time. So I want to say thank you again to Jeff, Nicole, Megan, Chantel, and Melissa for that great panel. And we'll see you all back here at 2:15 Eastern time. Thanks, everyone.
Great.
Hearing from Calderon. And so I'm going to give you all a small break, and then we can come back and hear from her. Just want to say thank you again to our panelists from the equity session. Really appreciate you, and thank you for being willing to do the breakouts as well so we could dive deeper. And we'll be back in just a moment with Miriam. Thanks, everyone. Right, so everyone, we're going to come back together. And we have our last hour of our roundtable session, and we're so excited to have Miriam Calderon, who is the Deputy Assistant Secretary of Early Learning at US Department of Education, with us here today. Excited to have you, Miriam. So I'll turn it over to you to start out, and then we'll have time at the end for questions. So make sure you're thinking about your questions. Feel free to go ahead and put them in the chat box. But yes, just make sure you use that chat box and we'll have time at the end for questions. So I'll turn it over to you now, Miriam. Thanks for joining us.
Thank you. Thank you so much, Mandy. I really appreciate you including me in this, and no pressure closing out what I'm sure has been a great meeting, but I guess that means you have a lot on your mind as you've thought across these few days that you've been together. So I really hoped, and I think you could take down the slide if you wanted. Maybe we could do sort of gallery view so we can see as many folks as possible. I was hoping this would be really an opportunity for me to share some thoughts, but then for us to engage in some dialogue and question and answers with the time that we have, especially. So again, Miriam, really excited to be here. I know you had an opportunity to hear from Katie to kick off the meeting, and you heard about the early childhood proposals in Build Back Better and what our administration has put forward, as well as what's kind of moving now through Congress. I'm happy to answer questions about that during the Q&A, but I thought I wanted to focus sort of the time that we had together on kind of 4 key areas and updates, and then again, leave time for questions and answers. So first wanted to touch on equity, the 4 areas: the early childhood workforce, birth through early grades alignment, and then kind of early collaboration across ed and HHS / sort of early learning governance is some of the kind of key areas I want to touch on before Q&A. So I will start and with equity and kind of want to cover 2 areas here. First, I think folks are familiar with the president's executive order on racial equity. So this is called, what really is outlined in that executive order is a whole of government approach across all of the sort of federal government enterprise to look at and examine barriers, both policy and program level barriers, as well as opportunities to advance racial equity. So ED, like many other federal agencies, are working on implementation of that executive order. What that looks like right now is, internal working groups within ED that first and foremost are thinking about how ED is itself an equitable organization, right? So many of us have probably been involved in processes like these in our own organizations or in government. What is our work to ensure that the administration of our programs, rulemaking, the secretary's priorities for discretionary grants, our formula grant programs, our peer review processes, our outreach and engagement strategies, right? Work to advance equitable opportunities and outcomes. It means something that I have definitely noticed in the going on, I think, 5 months now that I've been at the department in this role, that I've been really pleased to see, as well, is representation as well of staff, both in civil service and in political staff in the department. So really ensuring that as we bring people into key roles at all levels, we're thinking about the lived experience as an important part of what, of who we want to be on teams and leading and advancing important work within the department. This is a cross-cutting effort across really all of ed, who we bring into the department, who we listen to, how that's informed across all of the different program operating divisions. So across Office of Special Education, Office of Elementary and Secondary Ed, our Office of Post-Secondary Education. So some of all of the big program offices, our Office of Civil Rights, right, as well as in the leadership office and the Office of the Secretary and the Office of the Deputy Secretary in the policy division. How are we thinking about, again, ed as an equitable organization? So as this is ongoing work. It's both doing that internally and then really thinking about, right, what those then, and then looking at every opportunity, both new and current, to be able to advance the goals and the insights that come out of that. So I think you'll see across as things get finalized, like the secretaries, again, priorities for discretionary grants, information coming out of the Office of Civil Rights around data collection, thinking about equity. There's a lot of work, I think, as folks know, around a debt relief and relief from student loan debt burden, how this is operationalized. So it's both thinking about that internally and then thinking about all of the different levers and opportunities we have in the work that we do to administer the programs in the department that really advance this work and create more opportunities for people to benefit from the programs that Ed overseas. I think the other point I wanted to make about equity is really for us in our field and the opportunity that we have to support the work that you do in your states and communities is really the early childhood proposals and Build Back Better. I'm sure this has come up a lot in your conversations, but I really can't even sometimes process it fully myself, that we have before us and that our president has put on the table a once in a generation opportunity to eliminate race, income, zip code, ability, immigration status, language, all of these as predictors of whether a child and family can access a high quality early childhood experience. So I think at the pace that we were on between federal and state and local investments, right? We were years, decades potentially away from being able to achieve a level of really a shift in thinking about early childhood education, early care and education as sort of a public good, and one that could work to eliminate that as a predictor. And I think we are, this is the moment where we can begin that work, I think, and get to a place much faster than the path and the track that we were on. So, no pressure, I think, for all of us that are doing this work, but this is a huge moment, I think, to build an equitable early learning system for our country, and for states and communities. A couple of things that I think about in terms of this moment. One is just really thinking about scale. I know that there's a child care proposal and there's a preschool proposal. Really together, this is the opportunity to scale programs for infants, toddlers, and preschoolers, really address all of the years before kindergarten, both in terms of access and quality. So, I think about this moment of scale as we are all and have seen efforts to think about 1 year at a time kind of level of investments. And we know that has effect, obviously, on kind of supply and families' access and quality and what families experience. This is really, when you look at both proposals together, this is an opportunity to think about scale together, right? Truly advancing more equitable access to high quality programs for children in the years before kindergarten, again, birth through 5. It's as part of the scale, I think the moment is about resources, right? So it's not the resources for access, but again, equity is as much about quality, what children and families experience, as it is access, I think, as all of you know. And so really thinking about the resources to be able to not serve more children, but also build the capacity to deliver the quality programs that we will need to get to scale. So that, I think, this is a huge opportunity. The second point related to equity, I think, in this moment in Build Back Better in early childhood is, I think, another tool that you all will have is the ability to think about targeting. So how will you, while you may have a goal to get to universal or near universal, I'm sure Katie talked about, the child care proposal will cover eventually upwards of 70, 80% of eligible working families, right, through the child care proposal. And again, the preschool proposal is looking at supporting states to eventually get to a goal of universal access for all 3 and 4-year-old children in states. So yes, those are the sort of North Star, but you have the ability, I think, in both of these proposals to think about, again, first, how do you, with that goal of eventual universality, near universality, how do you think about children and who have been historically underserved, communities where there is a dearth of quality supply, and how do you build the kind of programs or enhance the kind of programs that are there? So first, prioritizing underserved populations and communities as you work to build capacity, I think is another important element around equity that's baked into these proposals. And then the last point I wanted to make around equity and BBB is high quality, both thinking about this from the the idea of you will have the ability and agency in these proposals to lead conversations around what quality means in your state and your communities, and to center really race, culture, language as part of those conversations, as well as be able to align the resources to get the resources to programs to actually meet high quality standards, not the least of which will be the important supports for the workforce, which I want to talk about in a minute. So thinking about, again, scale, we get to build it while it's daunting. We get to build it all, we get all 5 years, all 6 years, and we're not piecemealing this, right? We get to think about a comprehensive approach when we look across both programs. You will be asked through both of these proposals, and sort of baked in is to think about is to begin with the communities and the families and the children that have been historically underserved. And then you will have a lot of room to really to think about what quality means, how you resource quality, how you define it, how you define that with families, and particular thinking about culture, race, language, as a part of that effort. I also want to name attention around equity and BBB, and that is how fast this is going to happen. As you can tell from this conversation, I'm super optimistic and talking like it's going to happen. And I think that that's sort of what is needed right now, right? While I know that there is so much work happening right now to implement the federal relief dollars, right? To think about the resiliency and stabilization of providers, of programs as a result of this pandemic. That's like that is the tension. This is a way to both sustain these efforts, and sort of it's like doing that work and thinking about and planning for what will come, right, as a result of getting these two proposals sort of across the finish line in Congress. It could happen really quickly, and implementation. I think when I think about equity and I think about speed and implementation, that makes me feel tense, right? Because that's where the opportunity is really to be deliberative, to bring new partners to the table, to think about hearing from those who these programs are designed for, and who will benefit from, and really being able to do that work, bring new partners together, maybe partners that, haven't collaborated. I think from where you sit at the state level, I know it can, it can seem like we go to a lot of the same communities a lot, right, to sort of ask for input. And we'll be doing that again. So again, I want you to know we're committed to, I know I speak for Katie as well, if we get the opportunity to implement this, to be able to continue to work with you on implementation, I think, and to balance what we know are going to be, will be some of that tension, right, in terms of asking you to plan quickly and think quickly, and also do that with an equity frame and an equity lens in mind. I want to shift and touch on the workforce really quickly. So, building on kind of high quality and equitable access and opportunity. We won't, I think both we know we won't reach our goals around scale or equity without thinking seriously and deeply around the early childhood workforce. I know pre-pandemic in Oregon, as I went around the state and we were developing our state's early learning strategic plan, every time I asked what was the, any community, urban, rural, suburban, always ask this same question, what is the biggest challenge you face in being able to reach and serve more children in high quality early childhood programs? And the answer was always the same in every community: diverse, skilled workforce. That is one of the biggest challenges that we face. That was pre-pandemic. I know now we are hearing a lot. You're experiencing this a lot. Just what the media is talking about, right? The shortages in staff, the work in childcare programs. Our secretaries hearing about it as we talk about it. It's in public education. It's educators. It's all staff working in public schools. We know there is both a real, a need to think about our workforce goals in the immediate, very real immediate term, right, to respond to some of these challenges created by COVID. I think the shifts in the labor market, right, and what we know is happening, right, is a need to really increase wages and compensation in this field and many other industries, right, to be competitive with other sectors, right, who are also facing staff shortages. So it's the short term, and then really thinking about the long term. With Build Back Better, we are going to need thousands of new, recruit thousands of new educators and staff into programs. We will need to do a lot more to build up our systems to support the current workforce and the workforce that's coming in, to be able to deliver high quality services to children and families. For us at the administration, there is a real commitment to work across all of government, whole of government, across the Department of Education, Health and Human Services, the Department of Labor, both I think on the short term and the long term strategies. I know Secretary Cardona is incredibly passionate about this issue. So I'm really mindful around being able to support important shifts within the Department of Education. So anytime the secretary is talking about educator, and I know this because I've talked to him about this, he is always thinking about early childhood educators as part of educators and not just thinking about the K-12 system. And so how do we translate that vision and commitment that the secretary has and these opportunities to work with other kind of federal partners and agencies to be able to leverage the different equities within ed. So thinking across federal student loan, the federal, federal aid part of ed, our post-secondary education, career and adult education, right? And then how is that part of a broader sort of coordinated strategy, both short and long term, to meet our early childhood workforce needs? So we'll think about this. I have very much on my mind, like, what are the resources that are coming in to Build Back Better related to higher ed capacity, investments in grow your own programs, investments in minority serving institutions like our historically Black colleges and universities, Hispanic serving institutions, tribal colleges and universities that are really focused on our educator prep programs, helping recruit more diverse individuals to come to programs, retain them, help them be successful, improving the quality of those programs. Those are all important, I think, complements to, in terms of investments, to the investments that will be specifically part of the childcare and preschool proposals, that will be resources to come to you in your states to think about, right, your own workforce goals and partnerships with higher ed. So we want to definitely be a partner with you on that. I wanted to mention one specific current opportunity right now around public service loan forgiveness that is available right now to our early educators, which, and I can put, I can follow up with Mandy some resources. If this hasn't sort of crossed your paths yet, but we are in a really important moment, I think, right now to be able to support the success of educators, including our early childhood educators, and being able to get some relief from student debt through the public service loan forgiveness program. That this is a much bigger agenda at Ed, that around, managing student loan debt. So this isn't sort of the only opportunity, but this is right before us, and the department announced some changes to to the public service loan programs that will make it easier for more people who have had qualifying employment to actually see cancellation of some of their student loan debt. These changes are only in effect for 1 year, and the plan for the department is then to look at more permanent changes. So these are temporary, look at more permanent changes to make this program more successful for those committed to public service. So the temporary changes right now, and I say this from experience because I myself have been on the phone with, federal student aid for a couple of hours over the last couple of weeks trying to think about my own student loan forgiveness. The way I can sort of say this in the plainest terms is, before these temporary changes, you needed to have qualifying employment, have the right loan type, and you needed to be in the right payment plan. So all three things need to happen, right job, qualifying employment, right loan, right payment plan. Under these temporary changes that will be in effect for a year, you have to have made a payment while in qualifying employment, but the loan type and the payment plan that you were in are not being considered. So so this is, again, I think a huge moment. So to really help those early childhood educators, I think every little bit helps, right? And if this could be something that could make the difference for someone being able to stay employed and working in our field, or provide more for themselves and their own families, we want to make sure that the word reaches them, so that the word gets to them. Not all borrowers will be notified by the Department of Education, because we don't have, not everyone has presented themselves right to the department in the past maybe, and thought that this was an opportunity that could work for them. Again, maybe wrong loan type, wrong payment plan. So the department knows about some individuals that might be qualifying, but really this is going to require people to know about the program, to submit an application, and ask to be considered under these temporary rule changes. Again, eager to talk more about the early childhood workforce with all of you, but I just want you to know that thinking about and leveraging all of the equities in ed, especially our investments and programs, as well as how to help you as you think about what, how to bring those higher education partners to the table, is all work that we know and will be prioritizing as we think about our needs around the early childhood workforce, and especially if we get the opportunity and privilege to be able to implement Build Back Better. I also want to touch quickly on birth to 5 and the connections to the early grades, and say first that, Secretary Cardona talks about this as a moment of, as we think about what, the past 18, 19 months and COVID and what's happened, in particular in the public school sector, as a moment to transform public education. So this is very much on his mind as he's thinking about like a strategy. First and foremost, his focus has been an equitable recovery, how to get children into more, in-person learning, and reopen schools, do that safely for school staff, for children, and for families. But while his focus has really been getting those resources, highlighting great practices in the field, and what public schools are doing to return to in-person learning, which he believes is critical for the success of children and students. He is also thinking about what does this moment mean in terms of what's happened over these last 19 months that really can transform public ed. And when I think about his goals around transforming public ed, and all that work that the department will lead around that secretary's priorities, I think one of the most transformational things that it will happen to public education will be the early childhood proposals and Build Back Better. This is we know, I think I'm, speaking for all of us, that the K-12 system cannot achieve its goals for equitable outcomes for children, particularly subgroups of children experiencing poverty, our dual language learners, children with disabilities, if we do not have a more robust and equitable early learning system. So we, for us, I think in the short term, as we think about Build Back Better, that means a mix, thinking about what role the secretary can play in supporting your work to implement a mixed delivery system for preschool education, as is called for in the preschool legislation and as part of our administration's vision. So what role can ed play in really helping to message to LEAs and SEAs? Schools are a part of a mixed delivery system. How do we support schools to be partners in that system? How do we think about what more robust access looks like in states and communities to high quality early learning in terms of the implications for transitions to kindergarten? So I think mixed delivery in terms of a very big frame, especially connected to the early grades. So how do schools implement developmentally appropriate high quality programs, do so in ways that are collaborative and in partnership, and then support successful transitions to kindergarten? And then how do we begin really to work with the tools that we have across the department, particularly all of the policies and programs within the Elementary and Secondary Education Act, including Title I, right, to think about the alignment of policy and practice in kindergarten and those grade levels beyond. So those are, I think, again, really focused on what Build Back Better, I think, could mean and will mean for the opportunities to advance, I think, a birth through early grade strategy and system, and thinking, and we'll be continuing to look at the work that the secretary and will be leading around transforming public ed to spotlight, I think, what he talks about as we think about COVID. The impacts of COVID on public education are that, schools have had to reimagine a lot of their work and their work in partnership. They've stepped up and delivered nutrition and meals programs, thought about public family engagement in different ways, are thinking more about childcare for their staff, for educators, for the impacts in their community. I know I saw this in Oregon, right, of what it meant to not operate in person, and how that impacted families' abilities to work, right? Because we know our childcare system in states and across the country couldn't pick up all of the couldn't accommodate all of the impacts, right, of public schools not being available in person and meeting the needs of families to be able to stay in the workforce. So there are coming out of, I think this incredibly difficult time, the Secretary is honing in on. There are some bright spots to be able to lift up, and some practices that were put in place that we want to continue to encourage and support public ed and being able to continue. And so I think I'm excited for those opportunities ahead of us, as well as we think about this birth through early grades agenda. And then last but not least, I think I want to touch on collaboration with Ed and HHS, because we won't have really a birth to 5 and early and K-12 aligned system if we don't think about what that looks like at the federal level as well. And what are really more durable and sustainable structures that we can put in place to ensure that we take a systems approach to really thinking about what Ed and HHS collaboration looks like. We are working so closely across our department on so many aspects of Build Back Better. So it's been, I think, an incredible catalyst to be able to work closely with across our administration, with Department of Labor, with Ed, with HHS, in thinking about the opportunities for early childhood in the Build Back Better plan, which includes the American Rescue Plan, as well as the early childhood proposals in the American Families Plan. For myself, I want to share that I'm conscious of the fact that we made and aware of the fact that we made important strides in structures to support ongoing collaboration and coordination across the early childhood programs at Ed and HHS and the Obama administration. And including building more capacity at Ed to work in a cross-cutting manner to advance an early learning agenda. And I don't, much of that capacity and infrastructure wasn't sustained by the previous administration. So, the interagency policy board that was stood up during the Obama years, ceased to exist or operate in the same way. Continued to be a really great collaboration among civil servants and staff in terms of information sharing and meeting and aligning work. Obviously, work to co-administer the preschool development grants program continued across Ed and HHS. But being completely honest and straightforward with you all, I don't feel that that is sort of good enough for Katie and I, or for staff to have working groups across both departments that can collaborate, coordinate, share information is a robust enough durable structure for, I think, what we want to see happen, especially if we get Build Back Better. So we are absolutely committed to looking at how we do establish more structures for aligning policy, coordinating programs, implementing hopefully the early childhood proposals and Build Back Better, but bringing those in a way. So we are working together now. People have been working together across the departments. I don't want you to hear like that's not happening, but I very much want to ensure that, similar to what I think we've we've seen in states with state advisory councils or other sort of cross-sector initiatives that you have established in your states or communities. I'd like to see something, us do that at the federal level again, in a way that is more sustainable and durable and can even, meet the moment in terms of what we need to do, but also be something durable that sort of drives early learning governance. And then for me at Ed, it's really also bringing more capacity and expertise to drive early learning work across the department. There are, so many equities, programs, investments, expertise that can be leveraged across the department that I want to make sure can really be brought to bear kind of in this exciting moment as we get to work to implement the Build Back Better Act. And just, honestly, across all of our programs, early learning is a focus of so many, it's a part of so many things that Ed does, right? But there aren't very many programs outside of our IDEA Part C and Part B 692 programs where early learning there's an explicit focus just on children and families and birth to 5. And so there's quite a bit of, I think, capacity and coordination work we need to do internally ourselves, especially so that we can be a great partner to HHS and really align our programs and policies. So big area of focus. I'm sure there will be more to come on that. And I know you all have a lot, hopefully, to say about that in the time that we have left for Q&A. I can't believe I talked for that long. I feel like I talked really fast, but I think as you think about on this topic of, I think, coordination and collaboration, I'd love to hear more. If I can also sort of plant a seed for the time we have in Q&A, what you would like to see and what you think should drive some of our priorities around coordination and collaboration across Ed and HHS. So with that, I will stop and sort of open up for questions. I see people are turning their cameras back on. So that's great.
Yes, folks, feel free to turn cameras off, come off mute and ask your question, or if you can't, stick it in the chat box and I can read it aloud for you if you're not able. Just want to also really quick note, this is one of hopefully ongoing many feedback loops that we will have with Miriam, and also we're going to be doing with Katie. We've done one call already. If you were able to join that, we had about 10 states that signed up to go to that call. But we want to keep this going as things move along, particularly with Build Back Better. So go ahead and ask now, and hopefully we'll continue these conversations. I already see a hand up. Jana, do you want to go first?
Oh, I'm so glad I figured out how to raise my hand so I could pose. Marion, first of all, just amazing kind of recounting, and in support of you, this group of folks has seen you as both a local member, a government person at the state level, and also at the Fed. So you're like the perfect incarnation of collaboration, right? I have an anecdote for you, which I was recently talking to a mentee of mine from Baltimore, who they're back in class, and she's working on a literacy program with first graders, none of whom have had an experience in a group setting, first graders. So that kind of paints the story of this is because of the pandemic, but also the transition is not just 0 to 5 to kindergarten. It is also year by year, day by day into 2nd and 3rd grade. So I would just highlight that this group surely supports and would like to help with the idea of driving best practice of, to borrow Nevada, the teacher of the year there, of making early elementary grades joyful and just classrooms and driving best practice into those settings. I don't know how to do that. I think that only Ed can help support that perhaps not ACF and otherwise. So I'll stop there. Those are just two thoughts. And I know that this group is at the ready to find out ways to help with those things.
Thank you. Thank you so much for that, Jana. And it's good to see you. It's been a while. Absolutely. I think that is the secretary thinks about this conversation about transforming public ed. And, you know, I think it's a big frame to think about, you know, there's, and I can say this to this group, but sometimes I'm reminded of there are different words and vocabulary that we use, but there's, whole child approaches, thinking about family engagement differently, thinking about what that looks like in the context of teaching and learning, whole child meeting more comprehensive needs of children, both I think in terms of their academic achievement, but their well-being, trauma-informed practices, a bigger frame, I think, around social emotional learning and development. So what that looks like in terms of pedagogy and what our levers will be there, right? I mean, I'm queuing in on what you said about joyful and developmentally appropriate. I am 100% committed to, looking at this work across ed that the secretary will be leading, and looking at how we can work together to make sure that these conversations in the early grades are a part of that. I mean, I think honestly, this is a lot about my passion. And when I say like building more capacity at ed, it's a big department, and there's so many, again, programs and funding streams where these are pieces or levers, but a lot of, what ed, it's like, how do we get the early grades? Maybe how do we leverage Build Back Better? And that the obvious is that kindergarten and first grade and second grade will look different as we go years and years into implementing having a more robust early care and education system in states. It's how do you lift up those early grades within this big frame of a K-12 system? And I think that's part of, I want to think about what are structures and permanent capacity that we can build to do that, and then leverage all of these different moments and opportunities, transforming public ed, BBB, what all these different avenues might be to address what you're talking about. So yeah, I think that is the work, right? But I know that's work that we all share in terms of a goal that we all want to see. Ellen, hi.
Hey, Miriam. I'm still muted.
No, we can hear you. Yeah.
Okay, sorry. The sign came up saying I was still muted. Thank you for your remarks, and thank you for being at the education department. I have a million things I'd like to say, but I won't say all of them. The one thing I did want to point out to you is, well, I think we all have to realize that we look across all the states and we see so many different governing structures, and Oregon had its own unusual one. So obviously this can work. But as you know, and we all know, it does matter. And it's trying to figure out how to get past that structure. And I would just recommend, and I think I would love for all of us to consider advocating for a structure similar to the way West Virginia does their pre-K program. There's no one here from I couldn't find anyone from West Virginia on right now, or I defer to them to discuss it. But basically their pre-K program is jointly administered. And while the funds flow through the Department of Education there, they don't make decisions that impact anything important without the child care administrator there, the Head Start Collab director there, the head of Part B there, and the pre-K administrator there. And I would, I guess, like to advocate for that as the structure, as long as the funds are going to ACF, that there be this joint administration, or at least the policy part of it. The operational part may go through ACF, but the policy part is set with those 4 representatives at the table. So, and you don't have to comment. It may be hard for you to comment. I'm just wanted to get it out there.
Yeah, no, I appreciate that. I so appreciate that comment, Ellen. And yeah, that is that's a really fantastic structure, I think, for West Virginia. You know, to some of the comments I said earlier, I guess the only thing I would say is there is incredible collaboration happening right now as we think about and a commitment, you know, to look at you know, implementation of this program that looks across the programs at Ed, the programs in HHS, and that, you know, is absolutely essential for a mixed delivery system. What I also want to make sure happens is that it's sustainable, because to my comments earlier, you know, there was a lot of progress made at Ed and across and an experience now with developing a structure across Ed at HHS, and it wasn't sustainable. And so I think it's bigger than, you know, Miriam and Katie being able to work together, or whoever's in these seats. Obviously relationships are key, right? But that's, you know, that's systems work. We're you know, at the federal level, I don't think we're anywhere close to putting all the programs in one department or having a department of early learning like we're seeing happening in some states. But I think we can make sure that you know, hopefully in this administration, that we can make progress so that that we are always really thinking about both you know, getting something close to, I think, what you're talking about in terms of thinking about all of the different programs and investments is so important. And to your point, Ellen, I think it's important for, to my question to all of you, for you all to give us feedback about why you need that, right? And what that actually does to advance equity and quality and access for children and families. Like, why does this matter for children and families and the services that we want to deliver? So otherwise, we did work in Oregon while I was there. We already had a fairly consolidated state agency and legislation passed to establish a department. So that's the work that Oregon's on right now. So I have like this very recent experience for like talking about this, where I'm not just talking about like moving the chairs around in a bureaucracy, or like, I don't want to sound like a bureaucrat. Like, we have to be able to talk about this in ways, and anything that you want to see happen at the federal level, if you share what my sort of drive to establish something more durable, we all have to be able to talk about why this matters. And I'd love to hear from all of you about why this matters, and why this matters to the work that you want to do to build systems that can deliver quality services to kids and families in your state.
Miriam, we had a couple questions come in the chat. The first was around, I don't know if you're able to see them too, but I'll try to summarize, around funding from Department of Ed for math, literacy, and social studies consultants, but they seem to have more of a high school focus. So do you see any, you know, federal education funding for more early childhood or early elementary consultants?
Oh, sorry, I muted myself again there. That, I guess, Michelle, could you say a little bit more about
Sure.
That with the consultants you're talking about? Yeah.
And I did preface it with, maybe it's just Michigan's interpretation of how to use the federal education funding. Maybe it's just, you know, our superintendents over the years have focused on funding consultants that are assigned more to, you know, high school subjects, rather than across different areas or levels of education. And so I did realize after I wrote that, we do of course have like early childhood special education and Part C consultants, but no early elementary consultants, and certainly no federally funded through education, early childhood consultants.
Yeah, no, I appreciate that point. I think it makes me think about a couple of things. One is just sort of thinking about down the, maybe a follow-up conversation that kind of we can have as a group is experiences with ed funded technical assistance, really outside, kind of associated with like ESEA and the particular different title programs there, and what that has been, how that does or doesn't, what you've been able to leverage around some of this early grades work, maybe in sort of K transition work, because I think that's like really important feedback. I mean, when I just in my own experience, when I think about where a lot of the expertise is that we have around technical assistance to states, we have a lot of partners and collaboration around, obviously, with the early childhood special ed TA. I think as you're noting, ed, when Race to the Top and preschool development grants, the first preschool development grants were administered by ed. I think there was also some more opportunity for early childhood focused technical assistance with supported ed that connected to the early grades, not exclusive, like tangentially, but there was, we had some sort of strong partners. I think Build Back Better could be another opportunity as there are additional resources. So I think it'd be good to think about what are your current experiences like, to your point. So how could we think about that? And then I think a lot of also what you're describing is, and I think work we need to do at Ed, I hope we can advance is to think about what levers we have within ESEA right now and those consolidated state plans and such to be able to lift up the early grades. If it's more a focus, because I think we get into a lot of general and broad because we're talking about K-12, and then we get into the system as a whole. And again, it's sort of, we'll have to look for any and all opportunities, I think, to be able to lift up the early grades within that work, especially that's what ends up driving a lot of RTA. I appreciate the comment. Yeah.
The other question was around sustainability. And that was one of the questions we had talked about before, Miriam, around either the state match hesitation with the federal funds because of the 3-year in the state match process. So anything you want to say on sustainability?
Yeah, I mean, I think that I guess a couple thoughts. One is that, when we talk a lot about, when we think about the Build Back Better agenda, we talk about it, there are several different programs and plans within that. One is, ARP and the rescue and funds, which we know you're all sort of heads down and thinking about implementation. For the early childhood proposes some of the more transformational things that I know are hard to get done in states with ARP funds, the areas where you want to make kind of more, have big impact and transformational changes are hard to do without that sort of sustainability plan. So I think we need to be talking about like it, for Oregon, sort of to give you an example, we had some of the highest co-pays in the country. I think we were tied with one other state for the highest co-pays in our child care subsidy program in the nation, such that, the program wasn't really accessible because of the co-pays to families really outside of 100% of federal poverty because of such high co-pays. And I remember negotiating, having conversations with, the budget folks in the legislature, like, well, what's your what's your sustainability plan? These are one-time funds. And, it's like, well, could we reframe that? Like if one-time funds covers 2 budget cycles, 2 state budget cycles and 4 years, is that like, could we think about that as a pretty good, not obviously sustainability, but a pretty like smart investment, like with these monies? Because how many other things can we say we could cover for 2 budget cycles that we fund in our state budget? But anyway, but just thinking about that example, like, how that being able to connect the dots around what you're doing and some of the more maybe transformational things that you want to do with your art, with the American Rescue Plan funds, and being able to connect that to, Build Back Better, I think is key. Obviously, then thinking about Build Back Better, that there are a lot of assumptions there. That means your states will take up and be able to participate in those programs in both the childcare and preschool proposals. I know there's a lot of work to think about how to make those as fair and as attractive to states, so that states really do participate in those programs. But I mean, that is just going to be key. And then obviously, some of the attractive part of that work is really thinking about how to, deeply about, I know as this proposal, it's moved its way through Congress, how the, how current state investments, how will be able to be leveraged to be able to support states to come into these new programs, how these programs fit together, right? So again, this is an opportunity for infants, toddlers, and preschoolers, right? And really truly funding birth to 5 systems in states that can deliver more equitable access. So there's work happening there as well. And then obviously this gets to sort of my comments about speed, right? It's also about, these programs do, have to be considered again by Congress. So there will be a period of time where we have to really show the impact together, all of us working together to show the impact of what this can have, right, in terms of impact in the lives of children and families and early childhood educators, so that this program will continue. So there's a lot there. I think we need to see where we come out, where we end up on the other side of what, as Congress takes action on these proposals through the reconciliation bill, and then just do the absolute best that we can with what we're given from Congress and the resources to make this successful, so that it can continue to so that we can build in that sustainability. But I would say, and I try to say this a lot, I really think we have to plan right now like it's going to happen, and be prepared for that, and talk. Maybe this is just my spirit in the way, but almost willing it to happen and talking about it and lifting it up. And I know that that's asking a lot as you're actually working to implement resources and support the resiliency of your providers and programs across your state in the moment that we're in right now. But I think we're really close. We're closer than we've ever been. And we have to, to just be honest, not like we've got to do really well with what we're given, so that we can, so you can sustain some of the more transformational things that you've done in ARP. We can make the case for in all of your states while both of these programs are needed. And we have to do a great job with implementation so that the program continues.
Great. Thank you so much, Miriam. This has been so helpful to all of our state specialists and to all of us on the executive team. And we just appreciate you so much being here and taking the time today. And for everyone, again, this is just one of many conversations to come. We'll be sending out information to the listserv on how you can join one of these calls with Miriam and her team as we think through future with the Build Back Better and establish that feedback loop. So thank you so much, Miriam.
Absolutely, Mandy. I hope next time we're talking, will be very soon. I hope I have more colleagues at Ed that can help support more regular engagement with all of you, and that we are, we are turning the corner and that we can really start talking about implementation of much of what we touched on today. So thanks. I again appreciate the opportunity. Have a great rest of your meeting. Hope this was helpful. Thanks.
Thank you so much.
Bye.
We have just a few quick announcements for other folks. So just want to share this with you all. We have a survey that will be in the chat box and then sent out to you after this. We would really appreciate it if you would take just a few minutes to fill out the survey. Let us know how Roundtable went, what we can improve on as we think about next year being in person, and having our first as a full independent 501c3, our first in-person roundtable. So please look for that in the chat box now and also coming to your email. Just want to say thank you again to our program committee. Again, if you like something about how something went with this and you know one of these folks, please say thank you to them. They've worked really hard on this over the course of the past 10 months that we've been working on it. Particularly a big thank you to Robin Wilkins, who is leading that program committee. And so virtual round of applause for Robin and our program committee, and also to our executive committee for all their help with planning this today. We have one more happy hour coming today from 4 to 4:30. So we hope you'll stick around for that. And just know again that everything was recorded and we'll be sending it out to you, sending the slides, and as well as that survey. Thank you all so much for taking time the past 3 days to be here at this roundtable. We think it's gone very well, and we hope you do too, and let us know in the survey. And we are very excited to hopefully see you all in person next year. So with that, I'll close this out, and I want to say thanks again to everyone for joining, and hope everyone has a great rest of the day. Stick around. In about 2 minutes, we'll start our happy hour if you're staying for that. Thanks.